Hi everybody. Are you suffering from arthritis, any autoimmune or rheumatic diseases? Then I am sure that you will be searching in the digital platform for informations regarding this, and you will be overwhelmed by plethora of informations that is available in the digital platform. But not to worry, I will simplify this. I am Dr. Pradeep Kumar Shenoy, India's first DNB consultant rheumatologist, addressing you from Amrita Center for Rheumatic Diseases in Mangalore. First, let me introduce you to our mother bodies. First one is ACR, which stands for American College of Rheumatology. Second one is BSR, that is British Society of Rheumatology. Third one is ILAR, that is International League of Associations of Rheumatology. Fourth one is APLAR, that is Asia Pacific League of Associations of Rheumatology. And the fifth one, last but not the least, is IRA, that is Indian Rheumatology Association. These are our professional bodies. It is best for you to search in the official website of these professional bodies for the best information regarding the question you have. If you go to ACR website, you can find that there will be a lot of disease classification criteria that is given in the website. But this is not for clinical use. This is to create homogeneous population of patients globally while conducting a multi-center randomized clinical trials. This is not for clinical use. In clinical practice, to diagnose the disease, we use natural history of the disease, that is the pattern of evolution of the disease and the pattern of progression of the disease. This is very important in clinical practice rather than the classification criteria laid down by different mother bodies. Pain, swelling and stiffness in the small joints of the fingers of the hand that is going on for more than 1 hour in the morning and which continues for more than 6 weeks is defined as arthritis or rheumatoid arthritis. Very simple to say, but the pain, swelling and the stiffness that is felt in the small joints of the fingers of the hand, a layman could be perceiving it as a tingling, numbness, heaviness or a discomfort. So if you use these keywords for searching your queries, you will invariably end up with a orthopedic organization or a neurological organization. That is because neurology and orthopedics had evolved much before rheumatology. But nothing to worry, we will troubleshoot this. When you have a problem with the joint, that is pain in the joints, that is not because of the trauma or a fall, please do consult a rheumatologist. Let him request for some blood tests and let him do, if required, certain imaging and let him make a correct diagnosis. Then let him prescribe medications and then you can go back to digital platforms. You can use all the digital platforms that is available, including the AI platforms, that is Google Gemini, Anthropic or ChatGPT, and extract maximum information from this. And you can use this information for having a healthy discussion with your rheumatologist. This will culminate into a very meaningful discussion where you can extract maximum information from the rheumatologist. That is how you should use the digital platforms. This is something called as reverse engineering. Rather than going into the digital platforms first and then consulting the doctor, you consult the doctor first, then you can use the digital platform. Then that will be more meaningful. Coming to the AI platforms, there is a problem because in rheumatology, most of the symptoms perceived by the patients are subjective, they are not objective. For example, pain perceived by the patient can be felt and perceived only by the patient, not even the treating well-trained doctor. And the fatigue, that is the tiredness not relieved by rest, can be felt and perceived only by the patient. The doctor cannot report it by himself. He has to listen to the patient and report it. So patients play a very key role in the diagnosis and the management of rheumatic diseases. That is why AI role in the diagnosis of rheumatic diseases is limited. But in reporting imaging reports, that is CT scan, MRI, or X-ray imaging reports, AI can be used, especially in clinical trials. And they are very useful, especially if the clinical trials are conducted in a very large number of patients. So far, so good, but I'm sure that in the near future, AI will involve in rheumatology diagnosis and management with much more audacity and nuance. Thank you. In my next video, I will tell you how to cope up with gout. Do follow me. Thank you.